Oversight Subcommittee on State and Local Public Assistance Programs will come to order. Will the clerk please call the roll for today's attendance?
Chair Wolford.
Here.
Representatives Bruck.
Present.
Cara.
Here.
Cerniglu. Here. Menser. Here. Mr. Chair, you have 5 members present. You do have a quorum.
Thank you. Representative Menser moves to adopt the minutes of July 24th meeting. There being no objections, the motion prevails by unanimous consent. Today, we'll be hearing an educational presentation before taking questions from committee members. Adam Stacy from the Mackinac Center will be presenting on SNAP error rates and the new penalties that will be associated with high error rate under the One Big Beautiful Bill. Welcome, Mr. Stacy. Please take the table. And before you begin, I would just like to preface that currently in the state of Michigan, we have a SNAP error rate of 9.53%, which next year will cost the hardworking men and women and young people that are working, paying taxes, an additional minimum $300 million because we have a department that is not in order. And so with that said, Adam Stacy, thank you for being here today, and the floor is all yours.
Thank you very much. Once again, my name is Adam Stacy. I'm with the Mackinac Center for Public Policy. We are a nonprofit research and educational institute that advances the principles of free market and limited government. Before I served at Mackinac 2 years ago, I was a staffer in both the House and Senate over 25 years, split about equally between both chambers in various positions in central staff and member offices. So, as the Chairman Wolford said, I'm here to talk about the implications of the One Big Beautiful Bill Act, which I'm going to refer to as OBA from now on. That is kind of the terminology that my peers have settled on. Some other people have called it OB3. I don't know if that's going to take effect, but OBA is what we've been using. So, in regards to how it affects SNAP, obviously SNAP, as the committee is aware, is the Supplemental Nutrition Assistance Program, is what many of us commonly referred to as food stamps as we were growing up. It was a program that was piloted during the Kennedy administration. It was formalized during the Johnson administration, so it's been in effect for various decades. Currently, about 1.5 million Michiganders are on the program. This represents 1 out of every 7 persons in the state. If you look at the share of our population versus the rest of the states, we rank 13th in terms of the percentage of our population, roughly about 15%, which is on that program right now. Our numbers peaked in 2011. We had close to 2 million individuals receiving assistance. That is lowered and has risen post-pandemic as well. We're still a little bit higher than we were in the 1990s. This is due to various effects. You can see that the people enrolled in the program corresponds also to the state of the economy. Obviously, Michigan suffered from a single state recession in most of the 2000s, so the program enrollees went up. We then hit the Great Recession around 2008-9, so the program increased again. We're now post-pandemic, also still in a little bit of an advanced state, but also the federal government has also changed eligibility standards in the last 20 years, so that's also affected it. Talking about the error rates that we're here to discuss, the Government Accounting Office defines improper payments as those that shouldn't have been made or were made in the incorrect amount. So that means that they are totaling the overpayments, which is households that received more money than they were eligible for, and underpayments, which is also households or individuals who didn't receive as much food assistance as they were qualified to be. You take both those together, you divide by the total benefits, and that's how you come up with the error rate. So, OBA made some changes to SNAP. The most significant would be for the first time that the federal government is not going to assume 100% of the costs if the error rates are above 6%. Now, the 6% figure is not new. It was a guideline of the federal government going back into the, I believe, even early 80s, possibly late 70s. For the most part, in the 90s, 2000s, there was some enhanced funding for SNAP if states kept their error rate below 6%. There were also some penalties that were developed in the early 2000s as states, some were consistently not getting their error rates below 6%. So the 6% guideline that has been put into OBA that was passed in July, that's not something new. It's something that the USDA has been focused on for a number of decades. As of the fiscal year 24, only 8 states are currently in compliance with error rates at or below 6%. I would say it's almost about 10 states. Washington and Iowa are around 6.0, 6.1%, just above that threshold. So it's roughly about 10 states out of the 50 that are currently out of compliance with the law. And also another change is going to be, right now the federal and state government is splitting the cost share for administering SNAP benefits 50-50. That is going to change, and the states are going to be asked, well, mandated now to pay 75% of the cost of the program, and the federal government will only be contributing 25%. So how the SNAP error rate is calculated is a pretty lengthy process. Data is collected on a monthly basis, so even though there is an error rate that is determined at a certain point in time later on in the year, the data is collected monthly. First, the state has quality control reviewers. They're going to take a sample of the benefit cases, and they're going to review them and determine through interviews of the people, whether it's through the individuals of the people who are receiving the benefits, and they're going to do interviews to find out a little more closely what their criteria are, is how many people in the household, what their eligibility rates are, what their household income is, and they're going to match it up with what was their initial determination when they were enrolled in the program. After that, the federal government checks a subsample of these cases after the state has already done a quality control check. And after the federal government has checked it out, at that point, you're going to determine the actual error rate for the state. Now, it's also important to understand that when we talk about the improper payments, the federal government is only, in state government as well in their quality check, they're only concerned with if the payments are above or below a $57 threshold. So let's say the typical household, I think the average household can receives about $335 in monthly food assistance program benefits. If the household is receiving, $300 as an underpayment, that wouldn't count as an improper payment. Or if the household is receiving $375, that doesn't count as an improper payment. It has to be above or below this, and it'll come back on. It has to be above or below this threshold. So when we talk about the error rate that the federal government is fixed on at the 6%, there's already a built-in error rate already within the program of that $57 above or below what the household is qualified to receive. That number is also goes up for the next fiscal year. It's going to be $58. So I just want you to understand that there's already a little bit of a leeway within the program that the federal government anticipates before they start looking at the error rate. So as the timeline has been outlined in OBA, we will receive our official error rate on June 30th of next year. Now, that error rate is probably not going to come as a surprise to the department because, like I said, they're already doing monthly checks. They're doing a monthly quality check. The federal government is reviewing those standards. So based on those samples, the state already has an idea month to month what the error rate is before the federal government does its complete review and comes back with the final determined figure several, 6, 7, 8 months after the conclusion of the fiscal year. Also next year, the 75-25 share of the program is going to take effect on October 1st. So beginning in the next fiscal year 27, we're going to have the 75-25 lock in. Now, right now, as I understand it, the program costs roughly about $380 million to operate. So the state is assuming $190 million of that cost. The federal government is assuming $190 million. 75-25 share of that program means the state is going to assume of another $95 million, which is going to bring us roughly somewhere in the range of $285 million to operate the program. Then we have the error rate for the fiscal year 26, which is going to be determined the following year on June 30th of 2027. And then October 1st, 2027 for fiscal year 28, that is when the error rate penalties will take effect. So the state has the option to take the error rate of fiscal 25 or 26. Obviously, we're going to take whatever's lower to see if we meet the threshold about whether we're going to have to increase our cost share for the program. So currently, our SNAP error rates, if you just look back over the last couple of years, we were at 13% in 2022. It came down to just under 11 in 23, and now it's around 9.5% in 24. So there is progress being made. If you compare us to the rest of the Great Lakes states, We're still above the average of what's going on. Actually, we're probably, that's actually skewed a little bit because Wisconsin has been very, very successful in reducing their error rates. The Wisconsin error rate is somewhere around 4% right now. So if you pull that out, the Great Lakes average rate without Wisconsin was probably like 9.7 in 22, around 8.5 in 23, and somewhere in the low nines in 24. But Wisconsin actually helps bring down the average. That's a state that we absolutely need to be looking at closely to model about what they're doing correctly. It's a state very similar to us demographically. An urban-rural percentage is very similar to us. They have larger metropolitan areas. The only difference is they're roughly about 4 million people smaller than our state. And as you can see in the national average, we're still coming down below the national average, but there are a few outliers across the nation that are raising that up, and we can go into that further. So there, as we talked about before, there are two components of error rate. There's an overpayment and an underpayment. So the federal government is really concerned with just improper payments in total. But as you can see, and this is consistent across most states, the overpayments are roughly 5 times more the problem than the underpayment is dispensing benefits to an eligible individual or household in excess of what they're eligible for. In terms of the Great Lakes, we're still over that average on the overpayment. On the underpayment, we're actually getting pretty close to where that is right now. Oops, skip past one. Now, I just want to take a look at this historically, and I'll give credit to the Brookings Institution, which did a really nice graph of this. And you can see the error rates were far lower in the early 2010s than they are now. And there's a couple of reasons for that. As I said earlier, there were some incentives built in the program for getting your error rates under 6%. And so there were some states who were doing whatever they could to try to get those rates down lower because they were going to receive more assistance. It's possible, I think, that the enhanced funding for the program to get those rates lower was in excess of any penalties that would have been if they would have been higher. Several states were actually caught using a consultant that was not using the best advice, we can say, to show them how to lower their error rates. The federal government found that they were manipulating the data. They were fined. Several states were fined several millions of dollars for that. So the federal government in 2015, 2016 decided we're not going to calculate error rates. We're going to go back to the drawing board and find a way to measure the error rates more accurately. And so that's when you see the data coming back in 2017 that the error rates started going up much higher. The USDA claims this is more accurate. Most of the people who have stakeholders in the program have admitted that it is a more accurate rating. And that's where you see the difference between those rates in the 2010s versus the rates that have gone on since 2017. So the rates went up because the federal government was doing a much more accurate measurement of the improper payments. Remember, overpayments and underpayments. COVID-19 pandemic hit. It was decided that it was far more important just to make sure that food assistance programs were being distributed rather than focusing on the overpayments and underpayments. So there were no calculations made in 2020 and 2021. The federal government resumed its calculations. That's where we talked about earlier. Michigan's rate is 13% in 2022, and it's been coming down since. Okay, so OBA has looking at the penalty rates. So like I said, the federal government has been using 6% as its target for a number of decades now. And because many states have just consistently been above 6%, they have decided to start enact penalties. The program itself, nationwide, was distributing about $65 billion in food assistance in 2018. By 2023, it had risen to over $100 billion. There was, and the federal government also, through the General Accounting Office, did a study and found out that roughly it was like, they found out that it was 38%, if I can find the figure here that I wrote down to make sure I'm accurate. Yeah, about 10 years ago, the GAO did a study, and they found that the errors that were within that threshold, we talked about the $57 threshold that they weren't concerned with, the improper payments. They found that 38% of SNAP dollars were paid in error within that threshold. So, the error rate was probably larger if they hadn't assigned that $57 fudge factor, if you want to call it there. So, the error rate, if we're above 6%, below 8%, we're going to have to make a match of 5%. If we're 8 to 10%, we're going to have to do 10%. 10% or greater is 15. So what does that mean for Michigan? That means that if the enrollment figures held, and if the fiscal 24 total figures for the program, which is $3.2 billion, are consistent going forward, which may or may not happen, the error rate, if we're in that first 5% threshold, will be a cost of $160 million. The next cost would be $320 million, and if we were at 10% or more, we would be incurring a $480 million match for the program. Now, whether or not we fall within these categories, because of the 75-25 administrative shift, Michigan is going to have to absorb $95 million more in administrative costs going forward. So the fiscal impact is going to be between $95 million to $575 million. Earlier this year, you might have heard some media outlets claiming that Michigan might have been liable for upwards of $900 million in additional SNAP payments. That was an earlier version of the federal legislation that had called for a 25% penalty. That was not included in the final bill. So that's why the real target right now is upwards of a limit of $575 million as the maximum exposure based on the current federal funding rates and our current and what we could incur at the maximum penalty. So the main causes of the error rates, I know the committee has talked about some of this in detail before. We're talking about SNAP benefit tracking. We're talking about electronic benefit transfer card fraud and technical glitches. There are sometimes errors when the card won't read, and that can cause glitches. Retailer application fraud, errors fraud by household, and errors or misconduct in the quality control process by state agencies. Now, when the GAO did a quality control report, and they were focused on the variances, which is where the quality control reviewer found the difference between what was the original certification and what they originally determined. So they determined that there were three categories. There was another category that really wasn't an issue in the state, so I didn't list it. But income errors, which is the household not accurately reporting all of its sources of earned income, is really responsible for 2/3 of the errors in the program, which is why you see the overpayments as more a significant problem than underpayments, coming in around 5 times more. Deduction errors, which is where the underpayments can factor in, where they're not making the correct deductions on their gross income, that roughly was about 20%. And non-financial errors, that's just other eligibility criteria, looking at different factors about work requirements, correct Social Security numbers, how many people in the household, status, residency, ages, that is a remaining 16%. If you look, though, if who is to blame for these variances, it's roughly 50-50 down the middle in terms of the error made by the agency or the error made by the client. So roughly it's 50-50 down the middle that the agency either collected the data wrong, input error wrong, some misallocation of the program wrong, versus the client not giving the correct information or not providing all the various correct amounts or correct data that the individual person in the agency needs or the quality control reviewer. So what can be done to fix the error rates? There are a couple ideas. One of them was probably, I don't know where the current status is on this program, but a couple years ago, the federal government created the SNAP National Accuracy Clearinghouse. Now, the clearinghouse was to make sure that there is no dual enrollment of benefits between states. Let's say, for instance, a person from Oregon moves to Idaho. They start collecting their Idaho benefits pretty quickly, but some of the databases that are currently in play take up to 4 months to catch people if they're moving from state to state. So it's possible that people are collecting dual benefits. That hypothetical family could have been collecting Oregon benefits as well as their Idaho benefits for up to a period of 4 months before the system finally caught that and made sure they were fully transitioned to their new state. All states have pledged to join by 2026. The federal government has mandated that everybody join by October 2027. But as soon as possible and technically feasible for the department to make sure they're participating in this clearinghouse as early as possible. We could codify those OBRA provisions to ensure state laws and practices are in sync with federal guidelines. We are still waiting for some guidelines to be developed. The act was only passed 10 weeks ago. The USDA is still providing guidance for a number of the different policies that are in play. We're still waiting on that. But like I said, the enactment of the goal of the 6% figure, the penalties, these have been in place for a while. In fact, many states have already faced penalties in the past, just not nearly to the same level. States that are habitually been above their 6% at a very high rate have had to pay penalties to the federal government. These penalties have only amounted to several millions of dollars, though, not the hundreds of million dollars that are going to kick in soon. For the most part, these states have had the option to take that penalty. Let's say it was a penalty of $7 million for being out of error consistently. They could take half that money and put it into stronger program controls to bring down their error rate. The federal government would then abate the remaining 50% of that penalty if they saw significant progress over the next few years. And another one is just to enact best practices of other states. I'm sure MDHHS is already looking at other states, but whatever they're doing, we should probably follow that model, whether we're doing that as strongly as other states. I know some other states have a second look review so that when the person is making the initial determination, there is a second set of eyeballs that can look over that case and make sure that everything is looking like it's met all of its criteria before passing on. That way we would be catching those possible improper payments at the front end of the process rather than at the back end of the process with the quality control reviewer and then the Food and Natural and Nutrition Services federal worker who'd be reviewing that. I also know in some other states they're using, other states have, some of the states that have the largest error rates I've seen also have local administration of benefits. So I believe Michigan has a state administration of benefits, which would make it easier if you were enacting training programs to make sure you had stronger controls on the training programs to make sure all your staff are following the best practices of what you're trying to do. And that concludes my presentation. Are there any other questions? Oh, actually, I just wanted to sum up that, just in total that, government should prioritize accuracy in delivering benefits to those who are eligible. The art of government is advancing public policy with limited resources. For a 10% error rate means that for every dollar that might be in an improper payment, whether it's an overpayment or underpayment, that's a dollar that's not going to those most in need, and that should be concerning whether or not the federal government is going to institute penalties or not. So, thank you.
We definitely have some questions for you today, and Mr. Stacy, I want to thank you for your hard work and your thoroughness on this. Thank you for being here. I really appreciate your work today. Representative Menser?
Thank you, Chair. I'm looking at the error rates, and they have decreased since 2022. And I was wondering what you attributed that to. Is that less SNAP benefit trafficking, less card fraud from either the user or the retailer? Do you think it's additional effort by the department to crack down on fraud? I'm just wondering what you attribute that decrease in error rates to.
Well, it could be a factor of, it could be all of those factors. I'm like I said, the focus on the financial penalties that in OBA is only been the last ratcheting up of federal government guidance. The federal government has always been monitoring the states for their error rate discrepancies. Like several states have already been under probation. They've already had to pay fines. The fines just weren't significant. And I think this is kind of the point where the federal government has tried to increase the cost share to the point where they can incentivize, the states to increase their efforts, at fraud reduction or even just clerical errors in the program. Like I said, the program is entirely funded by the federal government and then administered by the states. So, after decades, I think the federal government has just been ratcheting up the pressure more and more and more. Now, in Michigan, like I said, we have 50% is a problem of the agency in terms of the variances between the original statements and the quality control. In other states, like Maryland, Pennsylvania, 80% is a problem of the agency. So you can clearly identify it was a lack of training or lack of quality controls there. In some other states like Massachusetts and Kansas, 80% is the problem of the client. So whatever those states have done, they've actually done well on the training side and the administration and benefits side, and it's just a matter of making sure that the clients are providing the most accurate information.
Representative Bruck?
Thank you, Mr. Chair. Thank you, Mr. Stacy, for being here today. I'm trying to wrap my head around this. I have one probably easy question, then a couple more in-depth questions. But the error rate nationally, you mentioned a couple of states. What are those states, and what are their percentages? And I'm assuming it's weighted. It has a weighted average probably for that as well.
You know, that's a good question. I do not know if the average is weighted or not. I do know that the states that currently comply with the 6% are Idaho, Montana, Nebraska, South Dakota, Utah, Vermont, Wisconsin, and Wyoming. And those are in the range of somewhere around 4% to 6%. So there is no state that's really driven it down to almost a 0% error rate. There's going to be some kind of an error rate just with the complexity of the programs and the eligibility and the various requirements they're having to do. But in terms of the national average, yeah, the national average is at 11%. I couldn't tell you right now if that's just a straight average of all the 50 states and District of Columbia, and I think even the Virgin Islands.
What is the high? Do you know the highest rate?
Oh, the highest rates? Yeah, I can tell you the highest rates. Right now, the last check, it was Alaska, which was around 25%. Alaska is a little bit unique. Alaska made a incorrect determination. They had a backlog in their system, and they decided to just extend the benefits. They extended the certification to pretty much everybody in the system. So they had a 60% error rate 2 years ago, and the federal government fined them about $12 million for that. Last year, they have an error rate of about 24%, and they got fined again about $5 million. So like I said, states, roughly a dozen states in the past years or so have been fined, but these fines were in the order of several millions of dollars. I guess the federal government finally decided that these fines and errors just weren't enough incentive to increase the reduction in the errors and the improper payments that were made out.
Yeah. Well, thank you. It's amazing. Now, on this $56, $57, this fudge factor, that's a biweekly fudge factor, or is
Monthly.
that
Monthly
monthly?
fudge
Monthly.
factor.
Okay, and that's not even calculated in this error rate, but they know it's an error though.
Yes, like I said, there's kind of a built-in error rate in the error rate that isn't. They've given us a certain amount of administrative leeway to allow that $57, soon to be $58, above or below the correct payment for the household.
So I do run a business, and as this discussion has been going on, it's like I couldn't accept a 1% error rate in my billing or collections or payments, wage, payroll, et cetera. So my question is, in my business, when we find an error, we either overpaid an employee or we undercharged a client. We do our best to fix that error. So this error rate is made up of errors that have been found.
Correct. There's a sampling. Roughly, nationwide, the federal government takes roughly 50,000 samples. The states review. So each state, let's take it roughly, the states are reviewing 1,000 samples a year. The federal government then reviews a subsample of that, roughly half. So the Food and Nutrition Services people are reviewing about 25,000 of the sampled cases, whereas the states are reviewing 50,000 in total. And we use that to determine what the error rate is. Now, when those cases are reviewed, more often than not, they make those corrections. If someone is getting an underpayment, they will make that correction to make sure they're getting their payments. If someone's an overpayment, they will make that correction to adjust down so they're collecting at the correct rate.
So these aren't continual errors. These errors, and I know you're just the bean counter, if you will, and giving us information, but at the state level, they know there's errors based off the sampling, or not based off sampling, they know there are errors because they found them. The unfound errors are not even in the error sample or in the error percentage, but they're fixing these errors. But when they fix an error, that error is probably fixed, I'm assuming. So this is a continual problem, right?
Right. So we're talking about 1.5 million beneficiaries. We're talking about hundreds of thousands of households. If they're sampling 1,000 households, and they're fixing those 1,000 households, but based on the sampling, they're determining that 10% of the households are in some kind of improper payment, over or under. and that's where the error rate is. So yes, there is a larger uncollected on the over and undue on the under payments.
I'm just trying to wrap my head around that.
And it's a $3.2 billion program, and government programs are, as they get larger, are vulnerable to exploitation and administrative and clerical errors.
And you said Michigan is a 50-50, so we can't blame the SNAP. We can't blame the state for all of the error, but it's a 50-50, and you said Massachusetts 80-20. So obviously some states are doing things differently, doing things better. What's Wisconsin's? Did you mention that?
I've not been able to figure out what Wisconsin is doing correctly, although I will point out that Wisconsin hired a consultant. I can't remember when. It was probably in the late 2000s, or late part of the first decade of the 2000s. They hired a consultant to try to reduce their error rate. The consultant gave them either improper advice or, it caused them to, not represent truly what their error rate was. The federal government found out, the Department of Justice got found out, there was a legal settlement. So Wisconsin was already under the scrutiny of the federal government. So it's possible that the reason why Wisconsin is lower is because Wisconsin was caught and already made significant changes to their program far in advance. So they've had more time to implement those structural changes.
Mm-hmm. Okay, I appreciate it. Thank you. Thank you, Chair.
Representative Cerniglu.
Thank you. And thank you for the very detailed, informative presentation. It's all really helpful in the way that you laid it out as well. So, yeah, I'm seeing that Michigan's error rate is, going down at a good, looks like a good rate comparatively to the other, states that we're comparing it to, and I assume it will continue to go down if it continues on the same track that it has been. I actually have just a couple questions, but they're kind of related, just so I can better understand if that's okay with the chair. So my first question is, do you know what the 2025 rate will be or what you expect?
I do not. I'm sure that's internal data from MDHHS, and like I said, the federal government has to do a complete review. So no, I don't
Sure.
know that number.
Yeah, hopefully, just based on what we see on those other years, maybe it'll be close to 8%. I mean, I guess we could hope that it's under 8%, but it looks like we probably would still fall in the 8 to 10% category here, and costing us about $415 million if we add for the fiscal impact.
I mean, aside from the financial penalty, it's still troubling that, a dollar of every $10 spent is improperly paid, whether it's an over or under.
Oh, sure.
That would be roughly $300 million of money that is not properly going in the direction it should be going.
Yeah, absolutely. I agree that we should, certainly bring our error rate down. I mean, that's always the goal. Just trying to understand a few more things about it, because it looks like all of the states are struggling, with this, and certainly none of this is up to you. But I wish that we were not being penalized, since we are making progress in the right direction here at a good rate. But I just wanted a little bit of further clarification.
Representative Cerniglu, if you could you ask questions instead of making statements on what future cuts could be, because nobody knows that. Thank you.
Sure. I just wanted to, confirm that I'm thinking about it correctly based on his opinions. So you mentioned what we can do to fix the error rates. Join the SNAP National Accuracy Clearinghouse as early as possible. And I apologize, I didn't quite understand fully what that was or what that did. So maybe if you could just, for my own clarification, tell us again what that was. And then also the best practices. I heard a second look review would be good, and stronger controls on training program, but I didn't hear what some of the other recommendations you had were.
Yeah, the clearinghouse, once again, this is another creation of the federal government, and it's continued frustration that states had persistently larger error rates than the 6% guideline that they were focusing on for decades. So there's a current database that states use to make sure there's not a double collection. And roughly that database is used on a quarterly basis. So there's roughly about a 4-month lag in the data that's being collected and shared. So the clearinghouse is trying to create a more real-time, I couldn't say it's a matter of days, maybe it's a matter of a week or two, but it's a more real-time assessment so that when you're enrolling someone in a program, you can use this database to make sure they're not dual collection from another state so they can reduce those kind of improper payments down. And like I said, all states have committed to using this, but it's a different timeline. Right now, I think there's only maybe 10 states that are currently actively involved in it, and I'm sure more and more are going to get involved. But like I said, every way we can knock down a couple of tenths of % of our error rate would help, and it would be good for the department if there are any barriers, just remove those barriers and just activate this system as soon as possible.
And the best practices.
Oh,
Just one more time.
Like I said, some of these practices may be being implemented by DHHS right now, but maybe not as strongly. I know other states, like I said, have a second review where they have another person reviewing the initial determination even before it would go into the system and before a quality control checker could randomly sample that, just to make sure on the front end all the applications are absolutely perfect rather than possible errors that would be caught by quality control and then the federal government. The whole point is making sure there aren't any improper payments in the system that can't be randomly sampled and expose us to a greater cost share of the program.
Thank you. Appreciate you. Representative Carra?
Thank you, Mr. Chair. Thank you for your testimony today. I'm not a welfare queen, so I'm not really familiar with what the process is in terms of application. Are individuals who are applying for SNAP welfare required to submit their W-2 tax filings on the front end, or is it self-attestation, or what's that process like?
Representative, I would have to get back to you. I am not an expert on SNAP system. I have been trying to scale up my knowledge based on OBA and its budgetary impacts on the state. I have done a deep dive into how the error rates are collected, but in terms of the front end eligibility or the process, no, I don't have that information for you today.
Okay. Another question, if I may, is do you know the numbers in terms of how much money federally is coming to Michigan and how much is state revenue?
Just in terms of the SNAP program, it was a $3.2 billion fiscal 24 hit. The federal government assumes 100% of the SNAP benefits it has since the initial existence of the program.
We just have administrative costs.
We have administrative costs that were 50-50 shared. Those administrative costs, there's various rules. You have to submit a plan to the federal government for them to sign off, but they involve mostly staff salaries. They can also involve some infrastructure, some technology, but it's mostly the staff salaries that are involved in the people, the human resources that are administering the program.
And that was about $190 million last year?
Our share of it, the total was $380 million.
Correct.
The federal government was picking up half.
Right. Thank you.
Well, thank you for being here today. Obviously we've had in previous committees, and of course I had Director Hertel, who came before our main Oversight Committee, and front-end verification is important to the point that we spent $16 million on a website for front-end verification. And of course, we found out through our committees that no social security number or alien number were needed. Self-attestation was told to us by the department that they were following federal guidelines and they had to do that, and we know now that to be false. Also, it fascinates me to think that for all of these years, the department has been checking these error rates on a monthly basis and let billions of dollars go to the wayside. But now under the big, beautiful bill, there's an accountability piece that's coming. It fascinates me when I hear questions or comments from people who obviously have not run business or don't know how to properly run a business, We have a director hotel who runs a $34 billion business. And in our committee, she blamed this on fat fingering. And so it made me think in your presentation, Alaskans may have even fatter fingers than some of the staff here. But my point is to all of that, this is a lack of leadership and improper management. And if we continue on a talk track of being successful with a 1% error rate fix annually, by the year 2029, that will have cost us nearly $1 billion. And you don't run business that way, and you definitely don't run a business with taxpayer dollars of people who are working hard and losing out on those funds because of mismanagement. So, Mr. Stacy, thank you for being here today. And before we wrap up, I believe Representative Bruck has a question.
Yeah, sorry, thank you again, Mr. Chair and Mr. Stacy. The 6% that the government put in place eons ago was an acceptable error rate. And I have a lot of trouble with that, but I understand this is a huge program, lots of parts and pieces, lots of facts and figures from zillions of people. What is an acceptable error rate? I know you don't work for SNAP, but I mean you're a bean counter. You know facts and figures. What is an acceptable or a goal that we should be shooting for? I mean, obviously business is a different. I would have a different error rate, but I want to be cognizant of the program itself, and it's probably prone to errors. But what would be an acceptable error rate?
That's an excellent question. I cannot answer that myself. That's a question that lawmakers should ask the department and should ask their constituents. I would state that there was a reaction to sustained error rates in Virginia, and the question was posed to the Department of Social Services Commissioner, Kevin Erskine. And he said, based on the passage of OBA and the possible penalties Virginia was facing, quote, "The federal government has never paid attention to this before, and so this has now become a priority, and they are focusing on the specific error rate." That's not true. The federal government has been focused on this. They've been focused on it for decades. They're just finally getting to the point where they're looking for any kind of incentive, penalty, or whatnot to incentivize the states to reduce the error rates as far down as humanly possible. The 6% figure has been in place for decades, and that's just a starting point. If they can get states down to that, maybe there'll be a new determination of what is an acceptable error rate. But at this point, they're just trying to reach that 6%, which has been a guideline for them for a long time.
Okay, again, really appreciate your input. Thank you.
Representative Cara.
Thank you, Mr. Chair. I'm just looking at the overpayment versus underpayment error rate, 8.03% of the 9.53% from the fiscal year 2024 numbers were overpayment errors. And on top of that, nothing we would necessarily know, but if people are selling drugs on the side, whether it's prescription drugs like Adderall or marijuana, that wouldn't go into their income, though technically they're getting more money coming in for that as well. Do you think that might possibly be happening in some situations where able-bodied people are getting SNAP welfare handouts paid for by taxpayers, but also on the side selling drugs?
I can't comment on the underground economy and what that would do to a person's income eligibility.
Do you think it happens?
I'm just not in a position to comment on
Okay.
that.
I'm guessing it happens. Thank you.
Mr. Stacy, thank you so much. We appreciate you being here today. And there being no further business, this meeting is adjourned.